With ageing populations across the world, hospitals face the same pressures: rising surgical backlogs, tightening margins, and clinical teams stretched thin. That's where Atidia's Patient Optimizer, POP, comes in. This AI screening clinical decision support software, designed by an experienced anaesthetist, targets perioperative risk and patient safety by making clinical decisions earlier, smarter, and repeatable. Meet Daniel, the anaesthetist who helped design Atidia's Patient Optimizer. He was spending hours each day reconciling incomplete pre-op information, following up on clinical problems found too late, and triaging cases by intuition rather than by standardised risk data. These are system failures that are financially draining and create avoidable complications, cancellations, and extended stays. Daniel kept seeing the same avoidable problems: uncontrolled diabetes and blood pressure on the day of surgery, missed anticoagulation issues, and frail patients who needed targeted optimization. He needed a clinical tool that could identify these issues before they become crises. So he worked closely with the Atidia team to help design Atidia's Patient Optimizer, POP. The Patient Optimizer is a clinician-authored AI screening clinical decision support platform that actively identifies modifiable clinical risks, recommends targeted optimization, and integrates seamlessly with hospital systems so you won't have to overhaul your existing software. The platform also enables patients to complete dynamic, clinician-designed questionnaires remotely. The Patient Optimizer continuously analyses EHR records, prior clinic notes, medication lists, pathology, and device data to surface clinical issues automatically. Integration uses modern interoperability standards such as FHIR and HL7, so data is consolidated, auditable, and available where clinicians already work. As a screening tool for clinicians, the Patient Optimizer's rules and AI-informed algorithms are authored and reviewed by clinicians to flag risks early, such as uncontrolled diabetes, anemia, anticoagulation timing, infection markers, or frailty indicators. When an issue is identified, the platform recommends specific evidence-based optimization steps and routes the case to the right clinician for action. Detecting issues early lets us act, conduct medication reviews, optimize outpatient care, or deliver focused prehabilitation, ensuring patients are safe when they arrive in the theatre. That active identification and routing is critical. The software finds issues clinicians might otherwise only discover on the day of surgery. Additionally, a sophisticated length of stay algorithm enables patients to be scored for the risk of prolonged hospitalisation using clinical variables and historical patterns to predict who needs early intervention. By focusing resources on the relatively small number of patients likely to have a long stay, teams reduce length of stay, improve bed flow, and protect capacity for elective care. Reducing variability in care and preventing complications is the primary clinical goal. Every complication avoided is a patient benefit and a clear reduction in downstream clinical and financial cost. The Intelligence Patient Optimizer returns benefits to the entire clinical team by automating screening and highlighting the right patients for clinical review. This ensures specialised clinical time is spent on assessment, optimisation, and complex decision-making rather than paperwork. Patient Optimizer is cloud-hosted on secure infrastructure and built for rapid, low-disruption adoption. It layers over your EHR using FHIR and HL7 standards, so you keep existing systems and workflows. Clinical authorship, configurable pathways, and local governance ensure the software supports institutional protocols and is auditable at every step. When clinical teams work from a standardized, repeatable pathway, safety rises and variability falls. That means fewer cancellations, fewer complications, shorter stays, and, most importantly, safer care for patients. The financial returns follow from improved quality and predictable capacity, but the primary measure is clinical safety. Patient Optimizer has been designed to shift the focus back to the clinical decision-making. It finds the risks we might otherwise miss and gives us the time and data to manage them. Book a demonstration to see how POP integrates with your systems and starts reducing risk, complications, and length of stay. Patient Optimizer, earlier detection, smarter optimization, safer surgery.